You know, when we think about spinal cord problems in the neck, we almost always picture a pinched nerve, right? It's a simple idea. Something's squeezing the cord and that's the problem. But what if I told you that's just a tiny piece of a much, much bigger puzzle? Today, we are going to unpack a totally new way of thinking that could change everything we thought we knew about this. Okay, let's just jump right into the mystery. Check out these 3 MRI scans. Now, on the left, you're seeing a spinal cord that is getting seriously squeezed. But here's the kicker. That person feels totally fine, no symptoms at all. Meanwhile, the person on the right has severe disability. The amount of squeeze just doesn't line up with the symptoms. So what on earth is actually going on here?
To even begin to solve this puzzle, we first have to get on the same page about the condition at the very center of it all. It's called degenerative cervical myelopathy, or DCM for short. So what is DCM? Well, in simple terms, it's a progressive condition where, over time, the normal wear and tear on our neck bones starts to damage the spinal cord. And this can cause a whole host of issues, everything from pain and numbness in your hands to problems with your balance and walking, and in the most serious cases, it can even lead to paralysis. It is incredibly common and, honestly, often really disabling.
And here's the thing, the scientific community has actually known for a while that this simple squeeze theory just doesn't hold water. I mean, this quote from the research says it all. Basically, just measuring how much the cord is compressed on an MRI is a terrible way to predict how a patient actually feels or how their condition might change over time.
In fact, there are 4 major clinical observations that the simple compression model just can't explain. So let's break this puzzle down, piece by piece.
First up, just like we saw in that first MRI, tons of people are walking around right now with spinal cord compression that you can see clear as day on a scan, but they have 0 symptoms, none. If it were just about the squeeze, all of them should be having problems, right? But they're not.
Second, even in people who do have symptoms, there's no clear connection between a bigger squeeze and worse symptoms. You can have a tiny bit of compression but be severely disabled, or have major compression with just a little numbness. The math it doesn't add up. And third, the timeline is all over the place. A patient's condition might be totally stable for years and years, and then boom, out of nowhere, with no obvious change on their MRI, things suddenly get much worse and fast. The old model has no way of explaining this stop-and-go progression. And finally, when we look with more advanced imaging, we see that the damage isn't just happening at the tightest spot. We're finding microscopic injuries way above or way below the main point of compression. And that tells us the injury is way more widespread than a simple pinch could ever cause.
So, with all these pieces that just don't fit, researchers knew they needed a better model. They needed a whole new framework, which led them to a new way to think about the injury, one that could actually solve these puzzles.
And this is it. This is the big aha moment. The injury isn't a single thing. It's an equation. It's a function of 3 critical factors, all interacting with each other. The total mechanical stress on the cord, a person's individual vulnerability, and, of course, the element of time. You have to look at all 3 together to get the real story.
All right, so let's break that equation down. We're going to start with the first part, mechanical stress, and you'll see pretty quickly why it's so much more complicated than just a simple pinch.
See, the spinal cord isn't just being squished. It's being hit with a whole cocktail of forces. Yeah, there's compression, but there's also tension from being stretched out. There are shear forces when it slides across rough surfaces, and there's even bending and twisting every single time we move our neck.
So we have to shift our whole mindset from a static, inward force, the pinch, to something way more dynamic. I want you to imagine your spinal cord stretching every time you look up, or rubbing back and forth over a little bone spur thousands of times a day. These dynamic forces, this tension and shear, they might be just as damaging, maybe even more so over time.
And here's why that's so important. The spinal cord is made of something called a viscoelastic material. The best way to think about it is like memory foam, right? If you press your hand into it slowly, it gives way really easily. But if you were to slap it fast, it feels much firmer. The cord is exactly the same. It reacts totally differently to fast, repetitive forces like shear and tension than it does to slow, constant compression.
So that's mechanical stress. But what about that second part of our equation? Why can 2 people with almost identical stress on their spinal cords have completely different lives? Well, that comes down to individual vulnerability. The researchers in the paper came up with a fantastic analogy for this, a Jenga tower. Think about it. Our body's ability to resist and repair damage to the spinal cord is just like this tower. It's built from all these different biological blocks, and its overall stability depends on how all those pieces fit together.
So what are these blocks? Well, some of them are what you'd expect. Our genetics, the natural process of aging, our cardiovascular health, which affects blood flow to the cord. But it also includes things we might not expect, like our gut health, our nutrition, and even our brain's own reserve capacity to sort of rewire itself to work around an injury. So two people can have the same stress, but one might have a much sturdier Jenga tower than the other.
Okay, this new framework is really fascinating stuff, but what does it actually mean for patients, for doctors? Let's talk about the real-world impact of moving from a simple squeeze to this more complex and, frankly, more complete equation.
Well, this new understanding opens up a whole world of possibilities. For one, it could finally help us predict who, out of all those people with a compressed cord but no symptoms, is actually at risk of getting worse. Two, it points to treatments that go way beyond just surgery. Imagine therapies that don't just relieve the pressure, but actually make the spinal cord stronger and more resistant to damage. And three, it empowers patients to take an active role in building up their own biological resilience. So really what this all means is that we're moving away from seeing DCM as just a hardware problem, a physical blockage in the spine. We're now starting to see that it also includes the software, our body's overall health, our genetic code, and its incredible ability to adapt and repair itself. It's a much more holistic and, honestly, a much more hopeful way of looking at it. And that leaves us with a truly powerful forward-looking question. If our own biological resilience, the stability of our personal Jenga tower, is a huge part of the equation, what does that mean for the future of care? Maybe, just maybe, the best way to treat and even prevent this devastating condition isn't just about a surgeon fixing the hardware, but about all of us finding new ways to strengthen our own bodies from the inside out.